This podcast is for general information purposes only and is not intended to create a physician-patient relationship. It is also not intended as a substitute for diagnosis, treatment, and/or advice by a qualified healthcare provider. Please promptly schedule an appointment with a qualified healthcare provider if you have a healthcare condition that has not been diagnosed or that is not under the regular care of a healthcare provider, or you're considering changes to your diet or exercise routines. Please refrain from self-diagnosis and/or self-treatment. And if you have a medical condition situation that may be urgent, then you should immediately report to the nearest emergency room.
And flat tires called jobs. But if you have a spear called determination and an engine called perseverance, with insurance called faith and the drive to make it, you'll reach a place called success.
So, hello and welcome. It's Dr. J, and welcome to Reach a Place Called Success. I'm so excited today to introduce my guest, Claire Este McDonald, who is a unbelievable. There's such a laundry list of things that I could say here, but the bottom line is that she's hopefully becoming a really close friend. But she's a Master Baptiste teacher. She's a yoga therapist. She's a registered nurse, and she's an Ayurvedic counselor. So at this point, welcome, Claire.
Yes. Hi, Jay. It's nice to be here. Thank you for having me.
Absolutely. I'm so excited that you are here. And today is the first of several podcasts that we're going to be doing in succession. And we're going to have kind of a general theme of each of these podcasts. But the bottom line is the reason why we're doing it in this fashion is because what Claire and I have quickly found is that we have a lot of synergy, and we could literally talk for hours regarding a lot of different topics. So today we're going to be discussing some incredible things that Claire has gone through personally from a medical standpoint. And at this point, it's one of those things that I would like for you to give us a little bit of a background as far as your Western medicine training is concerned, and your introduction into your diagnosis.
Yes. So, as a little girl, I was very much into healing. At the time, I wouldn't have considered that healing would have been the term, but I loved animals, and I found myself being drawn to nature. I had an incredible grandmother who was very much, everything was like gardening and from the land, and she was a holistic cook, and she just was a very, very kind and loving, gentle woman that was very much connected to nature. And so I had a very, very wholesome background, like connected to things that were very, very homemade and simple. And I became a nurse. I went to nursing school, and what inspired me to go to nursing school was that my grandfather had been ill, and he had lung cancer, and I took care of him. I spent a lot of time around him and making sure that, he felt loved and he felt taken care of. His background noise is my cat. And this is the way it rolls in my house. Again, my love for animals. We have five dogs and 3 cats. So you're going to hear a lot of background information.
That's
here. Great.
Please introduce them as they maybe come into the camera. Everybody loves animals. So
okay. All right. He's right now he's distracted by a cedar mothball. So I'm hoping that he'll just leave that alone and come and say hi. But going back, like I went to nursing school, and very shortly into my career, I ended up sneezing, and I herniated a disc in my back. And I was just out of nursing school. I had a job working in an emergency room, which is like kind of an unbelievable thing for a young nurse. But I had been, since I was about 12 years old, I had been a candy striper, and I worked in the hospital, and had been exposed to a lot of support in becoming a, healthcare provider. And then when I had this back injury, I was left like really taken out because I couldn't walk. The sneeze, I ended up herniating a disc, and it took out my right leg. And so the first 6 months out of nursing school, I ended up having surgery. And it was then that I knew, like, okay, I had surgery and that was going to do something. But there was another level of healing because I needed to learn how to walk again. I could not walk properly. So I had to like find a different place inside of myself. And it brought me back to this connection with my grandmother, who had always told me to, like, you know, you got to close your eyes, you got to feel what's going on inside of yourself, you got to slow things down and get a sense as to where you are. And there was going to be something other than just surgery healing my body. There was a commitment to something happening inside of myself that had to partner whatever that was. And, you know, that's profound, but I didn't really get it until I had 3 more back surgeries. And my body was just really kind of shot. It kept happening in the same place. I'd have surgery and I kept having these reherniations. And it was very humbling. And I had 2 children and I couldn't even carry my children at that point. So all of this background in yoga and meditation and eating right and just super, super healthy lifestyle, but my body was still breaking. And it was through getting back on my mat. You know, I had a practice already, but it was after all this had happened that I really begun having a practice. Like, it was from a different place of just not doing poses, but understanding that my body couldn't do a pose the way it looked like for everybody else. So I was constantly having to modify and adjust and adapt. And it was through all of that that the sensitivity awoke, where it was the sensitivity of knowing, like, okay, I can still do this, but it isn't going to look like the way that everybody else is doing it. And if I cannot let that get in my way, then, you know, I'm still going to be able to have access to this practice that makes me feel really good and healthy inside. And, you know, that worked for a long time. I recovered from my back injuries, and it's as if I don't have them anymore.
Oh.
Yeah, it's extraordinary, and I feel very, very lucky.
I'm interested just a little bit as a spine practitioner myself. You know, and actually myself, I ended up having spine surgery, and I got into yoga, and it really wasn't until years into it that self-awareness, to understand the nuances about myself, I was able to really get as much out of the practice as I possibly could. But you were in yoga, you were doing nutrition prior to even having the back injuries, correct? Mm-hmm. And
yes.
Then you went to see, obviously, a surgeon, modern medicine, and they said the treatment here is surgery. Were there, and you subsequently had multiple surgeries as a result of this injury and the re-herniation that occurred. Were there any other treatments offered? Just out of curiosity, did you go and have anyone that evaluated you from a therapy standpoint? Anything else from a treatment standpoint that was offered to you?
Well, in Western medicine, you know, I had like SI joint injections because I had SI joint issues. And there was as much that could be accessed, like physical therapy and the injections, and then modifications in the way that I moved. And then I also, because I had such an extensive background in like naturopathic and allopathic, I did acupuncture, chiropractic medicine as well. Even Ayurvedic treatments or specific treatments that you can do where you do like oil massage and you shift the way that you eat, the way everything like those, like you can look at your diet and start making adjustments. And I had done everything. So there was this kind of this full spectrum of healing going on. But what happened was the pain was so bad that I couldn't get on top of it. And I had one of my back injuries happened when I was pregnant with my daughter. So I was like 3 months pregnant with my daughter, and I sneezed again, and I ended up blowing out like 3 more discs. And we didn't want to do surgery. Obviously during pregnancy, they don't really want to do surgery, but it was one of those things that the quality of my life was so impacted that there was no choice. And so I was very grateful for the fact that Western medicine has this tool. Like at times, we can think that surgery is a bad thing. We shouldn't do surgery because that's so invasive. But it's actually, one of the great things about surgery is that you go in and you fix something. And I was an ideal candidate because you go in and fix it. And then I had all of these other things in place that would help me to be able to maintain what happened. And in fact, that is what happened for me. Because of yoga, my core was very strong. My body was very stable. I happened to have that weakness in that part of my body. And over time, I realized, 20 years later now, I know that my body, like the energy was accumulating in that part of my body, the stress, like that's where I put my stress, is I would put it right there in my lower back. And the habits, the way that I did things, I was a marathon runner, a semi-professional runner. So it wasn't just yoga that I was doing. I was running, and I was also, doing swing shifts as a nurse. So my lifestyle was very, very fiery, and it was very, very powerful and amazing. But at some point, it was like burning the candle at all ends. And that was the part that I had to rein in. And my body seemed to respond and heal better when I wasn't so overly expansive, if that makes any sense. Like there's just a point where you can't stay up all night long and then take care of children all day long and then go for a run and expect that something isn't going to break. I think part of what happened in my body was that it was a way of saying, you need to slow down. You need to slow down. And, now that I have much more balance in my back will every once in a while kick up nowadays. And I always know that the triggers, when I've been doing too much, that's the place that tells me, my body will say intuitively, like, you need to chill out. You need to slow down. And so it's not just a physical thing. It comes back to like understanding the nuances of your own energy and how you express yourself in life. And we're getting signals all the time. And then knowing when you're getting the signals, hearing them sooner rather than later. And I think it's a very powerful thing when you learn, like life happens to us for a reason. It's not like we're supposed to be getting it perfect. Nothing will ever happen to us. We're supposed to be engaging, and then we figure it out and we learn while we're living. And that's the part that I appreciate. I wouldn't change a thing. I wouldn't change one thing about what's happened to me, because I know in every fiber of my being, I can feel those experiences and know that there's wisdom there. And that's the wisdom that I'm able to share with others now in their journey and saying, okay, well, this is going to happen, but we can do something about that. We can work with whatever is experienced in a way that it's like feeling the tapestry of your life in your body.
That's great. These are great points. And I do want people to kind of understand, because I have seen the flip side of things, is the fact that the attention that you placed to try and help add on to the benefits that you would have received from the surgery by itself has really gotten you to the point now where you don't need any more surgeries, because this is the aspect that patients don't quite understand, that they have to play also a very important role in the healing process, even if they are going for a surgery to remove that disc that's pushing on the nerve, which is a mechanical issue a lot of the time, or a chemical issue if it's inflamed. But the idea is that you've spent so much time and effort to understand that, hey, listen, even if I'm doing all of the yoga and all the exercises and eating the things nutrition-wise, there's this other influence, that stress or whatever you want to say it, that is involved on a day-to-day basis. If you don't listen to that, you always kind of injure the weakest part of your body. And in you, that's the area that's had previous surgeries before, or whatever the circumstances are. The flip side of things is we see, unfortunately, all too often, these individuals that rely 100% on Western medicine and will continue to go see the surgeons. And then the surgeon will be like, there's not so many more surgeries that we can do. Or you get to a point where you have to start fusing the spine to create stability, because there's only so much material you can remove from a spine, and then it really does not have the stabilization that you need to protect those nerves. As an alternative, we're looking at patients requiring stimulators to try and mask the pain, or unfortunately, this is one of those cases that patients do get into that situation where they have to start relying upon a lot of narcotics, opiates, pain medications, and really feeds that terrible cycle that we see all too often. So this is a very important aspect that I'm so happy that we're able to talk a little bit about. Just curiosity, how long ago were those procedures that you had?
It's been 19 years since my last surgery. And you bring up a very good point, Jay, because what really kind of brought it home for me was after my fourth surgery, I was still in a lot of pain, and I was on the non-steroidal anti-inflammatory route, but I could so easily see how painkillers and narcotics could be something that at some point you just can't take pain that long. And I knew that, and I knew that I was not going to go down that road. And I'm grateful that I had a meditation practice and a breath work practice, and I could visualize my yoga practice. But as soon as I was told that I was going to need a spinal fusion, was when I knew, okay, I have got to get to whatever this is, whatever that seed is that is so stimulated, whatever that stress seed is that's so stimulated in my system, I have to get to what that is. And for me, it was, I was in a marriage that was failing. I was in a relationship that I didn't want to take on the emotional work that was involved in what I was going through. And I knew that was a big piece. And it sounds like that's way out in left field, but our emotional and mental well-being plays such a huge factor in our health and how it shows up in our physical body. And it was taking on that hard stuff. It was taking on what wasn't working in my life. And not that anybody was wrong or bad. It was what I was not dealing with. And as soon as I started to approach that, it was very challenging. But at the same time, I know, again, when I have pain in my body, in that part of my body, I know that I'm avoiding something. I know that I'm doing physical habits that tend to lead me to avoid emotionally and mentally what I do not want to take on, if that makes any sense.
It not only makes sense, it's so well said. I can't even elaborate it on it further. That was a great way to kind of touch on that point. I loved it.
Great. And then, and it was from there though, that all that sensitivity, when I was diagnosed with breast cancer 4 years in February, that was very, I don't think I was really surprised. I mean, it's shocking, obviously, but I remember, I shared the story with you, but I found out that I had breast cancer because I had a dream, and it was very clear in the dream. It was as clear as day that I went through the whole discovery process and diagnosis in this dream. And I woke up and I looked at my husband and I said, well, hon, I had a dream and I know I have breast cancer. And he just looked at me and he knows me after, 20 years, he looked at me and he was like, okay, I know we're going for a ride now. I know something's about to change. And he was horrified. And then I went to the doctor and it was confirmed that I had breast cancer. And I don't think I really got that I had breast cancer until probably about 6 months ago. The road that I was on was just so intense, and it just never ended. It was one of those things where initially when I was diagnosed, I was diagnosed with stage 2B. estrogen, progesterone positive breast cancer. And that was in the right breast. And in the left side, I also had 2 kind of weird nodules that would have turned cancerous. I don't have a family history of breast cancer. So it was one of those things that was like, came out of left field to my family and to all those around me that knew me. And initially it was just going to be one of these things where you go in, you have a mastectomy and it's a done deal and it's all over. And everyone thought it was going to go that way, but it didn't go that way. I ended up having 3 surgeries in a row within 2 weeks because I had the initial mastectomy and then I ended up having complications and having blood clots and all sorts of things where they had to go back in and do it again. So by the time I got to the point of having the mastectomy, it was 3 surgeries later, and then I was going into chemo. And before I could have chemo, I had to go in and have all these sort of hormones to suppress my ovaries. And I started chemo, and my body would reject it. My body was fighting it. So I would get very, very sick and have rash and fevers and all sorts of things would happen. And it was just one of these things where it was like, I thought I was going to walk through this as a yogi. I thought I was going to walk through and be like, okay, I'm going to meditate and I'm going to be able to stay really clean in my diet. I'm going to be able to just walk through this with grace. And it ended up being as gritty as possible. I just couldn't imagine it being any grittier.
And do you think that was because of all of the complications essentially that you had, it pushed you to that point? Do you think that if you had the one and done surgery, hit the chemo and tolerated that okay, do you think that, you would have gotten to that point that pushed you? Or why do you think that it was so difficult?
Well, everybody's body responds differently. So we have an algorithm in Western medicine of certain number will tolerate the chemo well, and others will have more complications. And some will have 1% will have those really bad, awful complications. And I just kept falling into the 1%. 1% of the population is going to have a hematoma. 1% of the population is going to have this sort of adverse reaction. I just kept falling into the 1% box. And so after you fall into that 1% box a couple of times, the mountain gets bigger in front of you. And you're kind of okay, so it's not just I'm going to get over this. I'm just going to ride over that hill and I'm going to be done. And breast cancer is going to be in my rearview mirror. That never happened for me in the way that we thought. And so there was that gap between what you think and what you can tolerate, and then what's really going to happen. And therein lies, though, the ultimate yoga practice, because, you get on your yoga mat and you think, I'm going to have a great practice. And then there were the days where you're 5 minutes in, you're thinking, oh man, I just want to run. I don't want to be here. And your mind is all over the place and your body is not behaving properly. And you just know, okay, set your gaze, recommit. Set your eyes to one point, breathe, just keep breathing. And honestly, I thank God that I had my yoga practice, because when I was going through chemo and then when I hit radiation, the anxiety, I had never been somebody who had a lot of anxiety before, but I had uncontrollable anxiety at this point. And it was one of those things where I knew that okay, so many things have happened that weren't going according to the plan. What else could happen that isn't going to go according to the plan? And I now needed to make sure that I accounted for that, so that in case it did, I could manage it, or at least I thought I could. That feeling of okay, I'm going to still have control here. I'm still going to try to hang on and think that this is going to go the way I want it to. And it just didn't. It never did. It never did. And it's one of the things now when, you really get strong. You really do get strong, because at some point you just realize there's something much bigger happening here, and I have to surrender to it. Like I have to bend my knees. I have to bend my elbows. I have to put my head down. I have to be in child's pose metaphorically as I go through this. It's not even downward dog anymore. It's just like, I gotta just drop and like, let it take me, let it just give over to it and let it take me. And it's different than giving up though. There's a huge difference between surrender and giving up. And, and that's a fine line for each one of us. It's not something you can say to somebody. You can tell them like, okay, you're in the surrender mode or you're in give up mode. It's like, you just go back and forth for a while. Because there were so many moments where I thought, okay, if this is it, if this is going to be like, if I've only got 6 months to live, then I'm going to live. I'm going to just enjoy what I have. And it wasn't enjoy like, I'm going to go on a spending spree or I'm going to, go to some foreign country that I've never seen. For me, it wasn't that. It was just in the appreciation, just simple things like, oh, today I'm not in as much pain. Oh, today I'm not as nauseous. Wow, that's amazing. And it would like, my whole day would turn into a like extraordinary moment because I was a little bit less nauseous. I was a little bit better, or I was able to go for a walk. And it was just an exceptional feeling to have that kind of freedom, to have that kind of simple appreciation that just became so epic. And it's a little different now because, my life has settled down. But I still have that feeling whenever I get a little too far ahead of myself in life and think that somehow I should be somebody. I should be somebody that's doing something really big in the world because I've been through all this. And I recently watched a movie by Ram Dass called Becoming Nobody. And it gave me that permission again, that I didn't have to like try to strive to make everything a big deal because I've survived breast cancer. I'm really surviving it because my diagnosis is more advanced than they expected. But I don't live in that place. I don't live in my diagnosis. I don't know how to, there's nothing I can do with that, in my opinion.
I think that's it's part of the surrender. It's kind of exactly like you just talked about. It's mind blowing though that like, and you do hear stories like this where, and excuse my French, why the fuck does it take that to happen to you to have that feeling, that epiphany, that surrender, that experience to be able to really just truly appreciate what you have? It's not like you weren't appreciating your life before, but to get to that level is, something that people do talk about. And that's why people need to hear this stuff, is that until you know, you don't know. And it's just a matter of, getting to that point in your diagnosis and in your treatment. Because I have to assume that like your doctors, what were they saying along the way? Were they saying actually that you have 6 months to live? Like what were the physicians saying as far as you and your prognosis?
They never said that. It kind of snuck in. My advanced diagnosis snuck in because what happened was I just kept having all these complications. So I ended up having 14 surgeries by the time it was all said and done. I had 13 surgeries between the right and the left breast, and because of complications. And I ended up having a hysterectomy. And where I nearly died was when I had my hysterectomy, where I had a complication during surgery where I had a vessel got nicked, and I ended up having, I was bleeding internally, and I had lost a lot of blood and had a strange thing. This is what's kind of a miracle, is I had what's called the rectus sheath hematoma. So the bleeding happened internally into the abdomen. And because my core was so strong, it sequestered off the bleeding. They were afraid to go in and operate because they weren't sure if they would make it worse if they opened me. And at some point, the bleeding stopped because my core was so strong, and somehow it just created a compressive force that the bleeding no longer expanded. And I ended up having 4 units of blood. And the doctor, it was one of the most wonderful experiences of my life. The surgeon afterwards, when I came to visit him a couple of weeks later and I walked in to see him, he bowed down at my feet and he held my hands and kissed them. And he said, "Thank God you're alive. I'm so sorry this happened. I never wanted to cause any more pain to you. And I'm just so sorry." And we knew this was a thing that happened. It was no one's fault. It was just, I think it was just in the cards. Like, these things happen because life is always teaching us something. And I didn't think of my complication as some kind of negligence. It was an opportunity that me and this doctor, he's still a friend of mine. He lives someplace now in Colorado. But it was an opportunity where he felt such a connection to me and I felt such a connection to him through what happened to me. All of these amazing relationships and experiences happened with my medical doctors and with myself. And he learned something about, the power of my faith. He learned, like, okay, something happens, but like, I wasn't going to turn it into a lawsuit. It was something that could turn into, well, okay, I can't believe I lived through that, is honestly what happened. And then I left and I thought, okay, now I have to take this on, but my body is able to do that. And, the other thing that happened the other time where I had another surgery on my breast and I ended up getting an infection that had a flesh-eating bacteria, just because of that's like the nature of having multiple surgeries and having chemo and radiation. Your body just doesn't behave normally after a while. The tissues they're all messed up. Your body is all messed up in a certain way that it just doesn't process information the way that it would normally. And so I had this infection that they didn't know how to treat it initially because I had allergies at this point to medications and they couldn't just throw another drug at me. And overnight, my doctor came in and he said, I think that we should pray. I think that I don't know what's going to happen to you. I don't know if you're going to be here tomorrow morning. I really don't. And I remember being really pissed when he said that. And he was like, well, it can't hurt if we just sort of like say a prayer and like, let's just put it out there. And I'm thinking in my head, I'm like, yeah, I'll say a prayer, but like, damn, this is not how I'm going out. And I remember that fire in my blood. Like, it was good that I was pissed. And I thought, like, I'm going to just let myself be this freaking mad. And the next morning, he walked in and he's like, "Oh my God, you're still here." And I'm like, "Yeah, dude, I told you I was going to be here." And my whole, I just turned around. I turned a corner. And so it's funny because, a lot of times we can think like anger's a bad thing or we shouldn't feel what we really feel. Like, it should always be good, especially as a yogi. We have to somehow get to a place where we're always serene or we're always like, I'm non-reactive. And I don't believe that. I think it's important to know, like, how do you really feel? What's really happening inside of you? Like, what's happening physically in your muscles and your bones and your joints and your spine? But what's happening in between that, your emotions and your mental focus is as powerful as a muscle. And I knew at that moment, like, anger's good. That fire, I need some fire right now to burn off whatever this is that's showing up in my system. Because if the medicine can work, but it's not the only thing that works. And I know that. I know that because I had to live that. And, so now I don't know, I'm in a remission. And I plan on staying in remission. I plan on never having to have the conversation of breast cancer again. But I have to, I still have to go visit my doctor so that, they can you got to have a good doctor because you got to have somebody who can step outside of your box and have some objectivity and say, okay, yeah, everything's good. Just go back out there. I don't want to see you for another year. And then I have to do my part. And so it's a dance. It's not one size fits all. And I can, just pretend it's not happening.
Mm-hmm.
You know,
What are you doing now? What would you say that, like, do you have a regimen, or is it just the way that you're living your life at this point now, and then you get your checkups from your physician? Is there an active role that you're playing now that helps with keeping things in remission, in your opinion?
yes, I have been practicing Ayurveda for over, I don't know, 40 years of my life. And Ayurveda is, the sister science of yoga. It's a science. It helps us to understand nature and our own nature. And I have a very disciplined regime. Like every morning I start my day with hot water, lime, and honey. And I have my physical movement, I call it, because I do yoga, but I also, like, on some days, like today I went for a run. Just before I got on with you, I needed to go for a run. My body and my energy required something. I could feel it in me that I needed to shift gears. And so I make accommodations for that. I have practices that are from the Ayurvedic tradition, like body brushing and body oiling. And, I take herbs. I do a lot with herbs and spices, and my diet is very, very seasonally balanced, and also balanced according to like what it is that my body is requiring, like what's happening. Like I read the signals of do I need food that's denser and heavier, or do I need to eat lighter on certain days? So I'm very much in tune with that rhythm that happens seasonally, and that's happening energetically with me. And it's given me my energy back, because it's a lot to overcome 8 rounds of chemo and radiation and surgeries. Like my body was just completely, it was like a piece of toast. Yeah. And I've finally got back my vitality. For a long time, I'd have to spend a lot of time in bed. Not necessarily sleeping, but like during the day, I would just get so tired that I would have to lie down a lot. And I haven't been lying down during the day for probably the last 3 months, which is, extraordinary. I'm studying to become an Ayurvedic doctor. So I have that. I teach a full-time schedule. I run programs. So energy is back. Like my vitality isn't just there for me to survive. My vitality is there for me to thrive now, which is, I credit that to like all of these things that I'm doing, because they just help. They're putting good things in, and it's working,
Obviously, yes. And this is kind of where I think the discussion will go next, is that it'll lend really well to even going back a little bit in time when you were talking about your grandmother and how it laid the groundwork for you to kind of have that idea of holistic healing, and having that extra senses and awareness for you to understand. And it's just a remarkable story about how you had that dream that essentially told you had breast cancer. It's not something that normally I would have gone back. I wanted to hear more about that, but I want to save that for the next podcast, because I think that's a very important aspect to have for all of us, whether it is regarding, just your particular circumstance with the breast cancer diagnosis, or just on a day-to-day standpoint to understand our own bodies and what we need for health and wellness. And I'd like to spend a little bit more time talking about that. And then obviously I'd like to spend another podcast literally just talking about Ayurvedic medicine, because I think the more I read and I hear, it needs its own kind of block and attention. So this is all part of the series that we're going to be bringing all of you. I know that you probably just want to keep listening, but I'm purposefully cutting it off because there's so much more to give, and I want to make sure that there's enough time and effort to be able to do that. So you're agreeing, right? You're going to be coming back, right?
Yes, I can't wait.
Good. So again, thank you so much for coming. and helping us reach a place called success. I'm Dr. J, and we'll see you soon.
Great. Thank you so much, Jay.
I want you to do one last thing. I usually do this at the end of all podcasts, and I'm going to do it with you also. People trying to get in contact with you, Instagram, email. What is the best avenue for people to reach out?
I would say Instagram, Facebook. They can email me as well. We're going to have our website. Will be up by next week. So claireandgregor.com is the name of our website. And I'm good with people emailing me, because I know this might touch some people very personally, that they may want some more information about, or if they have breast cancer, or if they're working with something. I'm good with email. So do you want me to announce that, or will you?
You can give it to me, and I can put it in my my caption on my Instagram too. The more the better, so people can be able to find you any way that they can. Okay.
All right. And I can send you that so that you have the
great.
That details. Okay.
Awesome. Have a great day, and everybody else. Thanks for listening, and we'll see you next time.
There's a curve called failure, a loop called confusion, speed bumps called friends, and red lights called enemies, caution signs called family, and flat tires called jobs. But if you have a spear called determination, and an engine called perseverance, with insurance called faith, and the drive to make it, you'll reach a place called success.